Hello, I'm Dr. Shelley, and here in Cleveland, Ohio, we have an 84-year-old woman who died from hypothermia and was found on the patio of a nursing care facility. We have a nurse being charged with both misdemeanors and felonies that include gross neglect, also involuntary manslaughter, as well as tampering with evidence or records. Now, we have a nurse who allegedly just graduated in July. It's January 2025. We have comments on Facebook that the facility left her out to dry, that she was falsifying records, that nursing home assignments include too many patients, that there can be a situation where new graduates are just out here chasing the bag. I am training nurses all day, every day, and what I see is profound. I need you to know that the schools are horrible and they're cranking out nurses after nurses who know nothing. So that's one. And mostly private schools are the worst. And on the part of nursing students who are looking for a quality program to go to, they don't know what they don't know. So what are they doing? They're looking for the quickest way to get a degree or a nursing license, which is called the microwave. And I think you need a crock pot. This is a very serious field to engage in. Then you have the issue of the nursing facility. In the hospital, you get about 90 days orientation. In nursing facilities, if you're a brand new grad, you may get 4 weeks. If you are experienced, you're going to get about 3 days. These nursing facilities are not optimal. Everybody out here knows that. Unfortunately, for so many people, it's the only option. Either financially, they can't do it in their homes, or they physically do not have the ability to take care of this patient in their homes. What we know is when this brother of this patient who died from hypothermia was interviewed, he stated that he did not come and pick her up. He also told the police that his sister couldn't even walk. So how she got outside is now another mystery. Apparently this nurse, one of the nurses, saw the patient at 8:40 p.m., medicated her. Patient was documented as being fine. But by 9:30, the new nurse came in and she wasn't in the room. I want to quote the nurse that was interviewed, and the body cam was on the news. Her quote was, "It didn't appear to me that she was missing. I do know she wasn't in the room." Another quote that I picked up on was, "I checked to see if someone had come in, basically to take her. I did not see that." Now, those are pretty incriminating statements. First of all, nurses, you know I've told you repeatedly, shut up. Every comment you make is got to be made through your attorney. And so when I see this interview, I'm alarmed. I'm like, whoa, what is going on? And it's disheartening to know that people still don't talk to the police without an attorney. The issue here is that this poor woman did not need to die, and this brother did not need to lose his sister. It was obvious that you're missing for 10 hours. Somebody needs to go down for that. I would agree. It's kind of similar to Redonda DeVault, in which her biggest error, if you think about it, the woman who medicated the patient and killed her with vecuronium, remember I talk about it all the time, just like in that case, that particular nurse had actually been an experienced nurse, but didn't even know the generic name for Versed, which is midazolam. Her original sin was she did not know the generic name for medications. And that goes back to, I believe these schools are doing an injustice. I don't think that people understand, because even when I tell them in my classroom that the average number of patients you're going to have in any nursing facility, not hospital, is going to be 32 to 50 on a weekend. Like, how are you supposed to even take care of that? And then 15 to 20 on a weekday. This is such a tragedy. I'm devastated. This woman didn't have a code purple called until 6:30 a.m. The police weren't even called till 7:30 a.m. The facility says that their policy is to notify the family, management, the police, and call a code purple. The facility said they have door alarms. Door alarms may or may not have gone off, may or may not have been heeded to. It's disgusting. It's really, really sad. And so all I can say is we will follow this case like we do all nursing cases, but I think that we need to understand it's bigger than just this nurse. But she definitely should be looked at closely as having a big role to play. At the end of the day, nurses, you are responsible for your nursing care, no one else. And no one else can be blamed when a patient has been missing for 10 hours. And then let me just close with this. Nowadays, 2025, we seem to not care when people lie, when they are completely falsifying records, putting out fake news. Just there is this lack of integrity in everything we do now. So that allegedly this nurse is falsifying records. I don't know how, either saying she gave a medication and she didn't or whatever it was. If that's true, it goes right up against what I said in this class to all the nurses. Integrity is number one. I just rewarded a young lady in my class this weekend during the 3-day boot camp that we had. I came in and I'm like, who the hell did this? And she owned up to it. I rewarded her because that's rare. I need nurses to have integrity. I need all of us to have integrity. Stop lying. Stop falsifying records. You know good and damn well you didn't do rounds every hour. You know you didn't even do rounds every 2 hours. And then as a nurse, know your limits. I've told all my new nurses, don't even think about taking 7 patients for an assignment at a hospital. It's unsafe and you need to say that. Focus on the patient. This assignment is unsafe for my patients. I will not take report and I will not take care of 7 patients. I don't know if this helped or not. It may just be me bitching, but that's my opinion on the situation.